All right, my name is Denny Hanson, and I'm a student in nurse practitioner school at University of North Georgia, and this is an oral case presentation on Kane Martin. Kane Martin is a female of unknown age from our information that we have, who presents to the health center for a checkup after missing work for a few days for undisclosed personal reasons. She presents and has no chronic conditions being treated by a doctor. She doesn't take any other medications other than her birth control. She's up to date on her vaccinations. Doesn't have any drug allergies. She's never been pregnant. Her last menstrual cycle was 2 weeks ago. She's never had any surgeries, and her family history is not currently relevant to her case, other than her father had a history of alcoholism. However, her social history is quite important to her case, because her chief complaint as of today is for a checkup. She hasn't had a regular WellCare checkup since she was 15, apparently. She currently lives with her boyfriend, works full-time as a waitress, and he works at a car wash. He dropped out of school at 17. And she graduated with a high school diploma. She tells us that her boyfriend, however, is unfortunately not very helpful at home, that he is jealous and does not want her to spend time with other people than him. He comes to her work unannounced and appears to check in on her for no reason other than just to check on her. For all we know, it could be just to be nice or to see where she's at and make sure she is where she says she is. She states that he has not been physically abusive, but her friends are afraid of him, and when he drinks, he becomes very mean. That's all the information we have there is the word mean, which could be taken in many ways. And he drinks apparently a 6-pack a day, so the information there we can put together that he is alcoholic, drinks, and is mean every day. And which could be, contributing to her calling out of work for her personal reasons. She also gives us information that her local support network is not very good. Her parents live far away, I believe it was 100 miles. She's unable to call her mom very often because it is long distance, and she does not able to pay for it. Friends are being drawn away by her boyfriend, so she is in definitely a potentially lonely situation with just her boyfriend, who is drinking. She also smokes cigarettes daily, eats unhealthy junk and fast foods, and does not exercise. She denies suicidal ideations and does not report any alcohol or illegal drug use. On physical exam, her blood pressure is 120/80, pulse is 80 beats per minute, respiratory rate is 20, and her temperature is 98.6. She appears thin and is pale, but has no obvious signs of bruising or injuries or physical abuse. Other than poor eye contact during her exam, she does not have any other negative findings from a physical exam standpoint. Her diagnostic studies on this visit included some basic lab work that appeared to be a comprehensive metabolic panel, cholesterol lab levels, and a self-report depression scale, which were all normal, and labs were within normal limits. This patient is most certainly at risk for physical abuse or domestic violence. As of now, it is unclear if she's being physically abused, but she's most certainly being controlled in a potentially unsafe environment with an alcoholic boyfriend, and something has caused her to call out of work for personal reasons and to show up for this visit for a checkup. Her differential diagnoses include domestic violence, depression, and poor dietary habits. Poor dietary habits due to the fact that she eats junk food, caffeine in her diet, most likely for energy because she's exhausted and not getting healthy foods and not exercising, high-fat foods. And this all contributes and could be why she is fatigued and doesn't feel like going to work. She could also be suffering from depression due to living with a situation at home with an alcoholic, angry, controlling, and potentially abusive boyfriend. This depression could also be contributed by her lack of support network, since her family lives far away and her boyfriend is alienated from all her friends. And then her last, but in my mind, her most worrisome differential diagnosis would be domestic violence from her boyfriend. This is supported by all the information we have included with him being angry when he's drinking, which apparently is every day, controlling, forcing her into sex when she doesn't want to, alienating her from her friends, and showing up to work to check on her, and does not want her to pursue a college degree, which could be assumption. He wants her to be tied down economically to him, even though he's not economically diverse as well. So in the end, she definitely is in a potentially unsafe environment. Already at this point, we could say it's definitely not a happy environment. She has chosen to show up for a checkup visit, so it could be that this is an outlet, even though she has not disclosed any physical abuse. It's important for us to give her those opportunities, to give her information on shelters that are close by, give her potentially a number for ourselves as a provider to call in a month just to give a checkup, just to see how things are going, and to give her an outlet if she were to need one. So, and that concludes this oral case presentation on Kate Martin.